We are strained. These people are working extra shifts. They're staying extra hours on their shift.
Good evening. For the first time in the COVID-19 pandemic, there are more than 300 patients hospitalized with the virus. The state reports 314 people receiving treatment across Utah's hospitals.
That's an increase of more than 20 since yesterday, adding to the strain already being reported by doctors and nurses. That's where we begin our team coverage this evening.
COVID impact specialist Jed Boll talked to frontline workers about their new campaign aimed at beating the coronavirus. Jed?
Yeah, what's it like to treat COVID-19 patients here in the ICU when some of them are dying and you're running out of beds? The doctors and nurses here wanted us all to understand that because we are all part of the solution.
Some days are really good, and some days you go to work and you really hope that just someone doesn't pass away on your shift.
This COVID awareness campaign starts tonight in our 10 o'clock news.
I never thought that I would take care of people that were my age, that were literally fighting for their life because of COVID.
Nurse Danny Beebe, featured in the campaign, is in her 20s and doesn't think everybody understands just how deadly this virus is.
We find ourselves fighting for these patients, cheering when they have successes, and crying sometimes when they don't make it.
Stressed about very sick patients, their own safety, and running out of beds.
It's rare that an ICU bed at this point stays open for very long before there's another patient that needs to come to our ICU.
There are real faces and real people that are dealing with this.
Pleading with the public to wash up, mask up, and social distance.
This is a real disease. You may not be in our ICUs. You may not know anybody that's been terribly sick with it, but there are thousands of people who are sick and over 500 who have died in this state.
Urging all of us to be their partners.
Be the community that we need you to be so that we can take care of everybody.
The medical director says right now they have the number of beds that they need, but they're having to juggle patients based upon the most critical needs. For Live at 5, I'm Jed Boll reporting.
Jed, thank you.